Ladies and gentlemen, boys and girls, welcome to another session of podcast. I wish and I'm sure you will enjoy listening to the broadcast. Many of us know the importance of eye, the king of the organ in the body, which gives you your vision. So we're going to talk about glaucoma today. So we have all studied about the anatomy of the eye and the function of the eye and everything in our school days. So you will remember it. So what now you have to you have to know is the shape of the eyeball as a ball shape. Why it retains its shape is because the eyeball is filled up with a liquid, which is called the vitreous. It is produced by the some of the cells in the eye constantly, and then there's a pressure maintained. It is not that it's a liquid which is produced and constantly there forever. No. It gets circulated. It gets constantly produced. It gets constantly drained. At the same time, a pressure is maintained. Up to 14 to 21 pressure is the right pressure. It varies from person to person. So there's a drain way. You can go and, to the anatomy of, you can go to YouTube and, go and see the anatomy of the eye, the function of the eye, the, vitreous liquid of the eye and how it, gets produced, how it gets drained, how it's constantly produced. All that stuff you can understand. Today, we don't need to depend on books. We have everything in the internet world. We can go and easily study them and all that. When this drain pathway gets narrowed down or blocked, then the constantly produced vitreous liquid start accumulating and the pressure of the eye becomes more and more and more. So what happens? It starts pressing your retina, which will result in pressure on the optic nerve. And then the damage of the retina and the optic nerve takes place. If you're not going to take care of glaucoma, you're going to become blind. This is very important. When you get some kind of a constant pain in your eye, please do take immediate care and go to an ophthalmologist. They have a small instrument. They put it on your eye, press it and check and see the pressure. Once the pressure is more than 21, they know that the glaucoma is set in. And the remedy is very, very simple. They give you some eye drop. And these eye drop, you have to use it as the ophthalmologist tells you, maybe once in the morning, once in the evening, something like that, twice a day, whatever. So you have to continuously use these eye drops, glaucoma eye drops, as the doctors advises you to do it. So what this eye drop does is it allows the drain pathway to open up so that the circulation keeps going and reaches normalcy, where the pressure of the vitreous is maintained to normalcy. So the impact on the retina and the optic nerve system is completely reduced so that you don't get into any damage, because retina and optic nerves are neuron cell related components. They are very complicated structures. They have very sensitive and they have huge amount of work that they are doing to, give your vision. So vitreous liquid getting pressurized is glaucoma. When the eye drops doesn't help in some cases, there are some small surgical procedures are also available. They are all foolproof system. Don't worry about it. They will make sure in the laser, they will go and open up the pathway, drain pathway of the vitreous liquid so that the circulation remains to normalcy, where the pressure of the eye is not built. Glaucoma is easily a treatable one. If you are going to ignore glaucoma without knowing what it is, you are going to land up in losing your complete vision within no time. A matter of months or 1 or 2 years, slowly you can see your vision getting reduced because it's going to affect your retina and the optic nerve. So those who feel some kind of a pain on your eye, glaucoma may come in both your eyes, sometimes may come in one eye, whichever eye is started giving you trouble by, causing pain to the eye, your eyeball starts paining. At that time, you can easily understand that the pressure of the vitreous is going up. So immediately you contact an ophthalmologist, check your eye pressure. Or whenever you go to an ophthalmologist for your specs recorrection and all that, you can always ask him to check your pressure and see the normalcy. Or once in 6 months or once in a year, go to an ophthalmologist, check your eye pressure, make sure your vitreous liquid circulation is proper, your eye pressure is maintained. So please do not lose your vision due to glaucoma. It is easily a recorrected one. This is a message to every one of you all. Good luck and goodbye till I see you in the next video. Thank you very much for your attention. Thank you very much for spending your quality time. Thank you very much for your attention. I wish you enjoyed this session. See you later.